Good afternoon, everyone. So my presentation is on family screening and genetic counseling in inherited retinal disorders. So, yeah. So starting with what is genetic screening. So genetic screening is a systematic approach to screen high-risk individuals and provide them with early preventive treatment and reproductive options. Since genetic diseases are heritable, family screening and consanguinity plays an important role in prevention of such diseases. So what is consanguinity? It's a union between individuals who have at least one common ancestor, and it's a deeply rooted social trend in one-fifth of the world population. In the world population, if you see, it's more common in the sub-Saharan area, in the Middle East, and in the West and Central Asia. In India, in a study done by Krishnamurthy et al., they found it more prevalent in South India, which is most commonly seen in Tamil Nadu, followed by Andhra Pradesh and then Karnataka. In autosomal recessive disorders, there's increased occurrence of a carrier state, and prolonged parental inbreeding has led to an increase in background homozygosity of about 5%. So the aim of our study was to study the impact of consanguinity and family screening on various types of retinal dystrophies. It was a retrospective observational study with a sample size of 2,885 patients. And among the dystrophies, the most common was retinitis pigmentosa, followed by cone rod dystrophy, Stargardt's, and other diseases. All these dystrophies found less than 1.25%. The mean age of our study subject was 31.59 years, and there was a male preponderance. There was 50.33% of consanguinity seen in our study, of which 92% was second-degree consanguinity, that is, uncle-niece or aunt-nephew marriages, followed by third-degree consanguinity. We studied the number of generations with consanguineous marriages in our study, and we found that in 81%, one generation was affected. In 17%, two generations in a family had history of consanguineous marriage, and in 2%, it was 3 generations. And when we counted the number of consanguineous marriages in families, in 75%, in one family, there were only one consanguineous marriage. In 20%, there were 2 consanguineous marriages. In 4%, there were 3. And in about 1% where there were more than 3 consanguineous marriages in a family. We also went ahead and studied the affected individuals in a family who again went and married consanguineously. Like as you can see in this pedigree chart, the female is an affected female, and she went on and married her maternal uncle, which is a second degree consanguinity. So what we found was that in 10.2%, one affected member went ahead and married consanguineously. In 1.3%, 2 affected members did that. And in 0.3%, 3 affected members went ahead and married consanguineously again. We did, in our study, about 60% underwent genetic counseling, of which only 4.7% underwent genetic testing. We had 102 families with any degree of consanguinity, and 46% of which were found to be affected with the disease. So to coming to the discussion, in consanguineous marriages, there's a 25 to 100% predictability of the progeny to get affected. In our study, only 7% underwent genetic testing, and 11.8% of the affected individuals eventually engaged in a consanguineous marriage. So all this highlights the lack of motivation and awareness among people about family screening, consanguinity, and genetic tests. So I just wanted to emphasize on the importance of genetic tests, highlight one case which came to us of a 29-year-old female with history of decreased vision, photophobia, and nystagmus since childhood. She had similar history in her sister. She was married out of non-consanguineous marriage, and she was 14 weeks pregnant when she presented to us. On examination, her best corrected visual acuity was 6/16 both eyes, and she was not able to identify any plates on the color vision chart. When you see the fundus photo, you can see atrophic changes in both macula, and the retina OCT shows foveal thinning with the outer retinal atrophic changes. We went ahead and did a full field ERG, which showed absent cone-specific responses. So a diagnosis of achromatopsia was made. The patient underwent genetic counseling and eventually genetic testing, and we found a compound heterozygous mutation for CNGA3 gene in the patient, and coincidentally, in her unrelated asymptomatic husband, we found a heterozygous mutation in one of the exons of the CNGA3 gene. So the patient again underwent post-test counseling, and she wanted to go ahead with the prenatal diagnostic test. She underwent amniocentesis at 16 weeks, and the fetus was also found to have a homozygous mutation in the same gene. On medical grounds, she decided on MTP. 1 year later, she conceived again and again underwent through prenatal testing, but this time it did not show any mutations and she continued with the pregnancy. So this case example shows how important is genetic testing to at least provide patients with reproductive options. So to conclude, what we knew was the negative impact of consanguineous marriages in terms of increased genetic risk. What our study added was South Indian data on impact of consanguinity and importance of family screening in retinal dystrophies. The future directions would be to improve awareness about consanguinity, genetic counseling and prenatal testing, consanguinity-based next generation sequencing to dissect the genetic cause of inherited disorders in families. Thank you.
So for our experience is concerned, we have worked on oculocutaneous albinism in Bankura and we found out two groups in oculocutaneous albinism in Bankura area, Tili and Tambuli group. But none of them are at all interested or they do not like to give permission to undergo genetic counseling en masse. Only those oculocutaneous albinos who got married amongst, those like to have the testing only to know whether the offspring will be oculocutaneous albino or not. That's why it's very difficult, and I am really surprised to see that these amniocentesis and others they have allowed.
It's a one-off case that
Yeah,
we have.
that that's a nice work, and we are looking forward that in future we will get such beautiful people who will allow this genetic counseling, because from government side, suppose from Calcutta, the Indian Institute of Chemical Biology, they are always ready to do genetic counseling of any community at large, but people are not at all interested or not permitted to undergo genetic